Hello, everyone. We almost finished the course of Occupational Ergonomics. Thank you very much for your collaboration. And I hope this course was useful for everybody, especially for those who would like to be an ergonomist in future. I thought that some notes are important to be mentioned. So this PowerPoint and these slides are just for your better understanding of some organizational services and facilities in the field of ergonomics. If you look at the news, you can see that ergonomics is a very dynamic field. So you can find many news that are related to the changes in regulations or the supervision of different companies. All the attempts is to provide a better, safer workplaces for most of the people, especially the Canadians in Canadian news. So the main goal is to redesign the workplaces in a way that can prepare a healthier, more comfortable environment for the workers, at the same time increase their performance and productivity, and also consider the individual differences in the design. So you can see many workplaces that they are aesthetically pleasant, but now after passing this course and the information that you had from the previous courses, you can understand that many of them need some kind of improvement or changes to be healthier and better. So it's possible that you have a beautiful workplace, while at the same time very functional and very healthy. You learn that three things are important in designing the workplaces in respect of the anatomical problem or musculoskeletal disorders. One is the posture, the second one is the amount of the force, and the third one is the repetition. For every design of workplace or every redesign of a workplace, you need to consider these three things. Also, you need to consider the environmental ergonomics, the effect of light, sound, the outdoor works, the cold, the temperature, everything that is related to environmental ergonomics as the risk factors, the biohazard in the system, everything that can somehow predispose your workers at the risk of an injury or a medical problem. You should certainly check also the cognitive ergonomics, evaluate all the risk factors that may cause the workers to be under higher stress, anxiety, burnout, or fatigue, and increasing the risk of errors in the system or predispose them to a different type of injuries. So they are the things that you have read in chapter 5, and so you should have planned for somehow minimizing these risk factors by different interventions that you somehow reviewed during this course. A poorly designed system doesn't match the needs of a human being. A poorly designed system doesn't take into consideration the human's limitations, the limitations in perceptions, in memory, the physical limitations, the psychological limitations, and set the standard so high that it's beyond the human's capacity. So it may cause the injury for the worker, at the same time low performance or low productivity in the system. An ergonomical model or an ergonomist actually work as a mother who is taking care of her child. So you see that how the mother may modify the house environment for her toddler to make a safe environment for the child. The mother can consider that what the risk factors in the environment may be. So, and how he can change the relocate the stuff, replace some stuff with the other safer stuff. So this is exactly the type of approach that an ergonomist may have in a workplaces to design in, the system in a way that the people can do the right things easily, but the wrong things can be done very hard. It's very important that you be a very good observer. You can recognize the risk factors and you can prepare your checklist. There are so many different checklists in different organizations or different companies and systems. It's very important that you have your own checklist, or you get yourself familiar with the checklists that are available in different workplaces. So there are the examples of different checklists and how they recognize the environmental, the physical, or the mental risk factors in the workplaces. This one was in your book, the NASA task load index, and you can see that they consider the physical and mental workload in one checklist. You have learned and practiced how to evaluate the maximum load. You practice how to check the safety index for the upper limbs, for the back. There are dozens of software that you can use them easily, so you don't need to calculate by yourself. You can use those softwares and they will calculate for you. But it was important that you understand how this calculation can be done, and that is why that we practice these things. You may also have access to softwares that simulate the work condition and workplaces, so you can predict the amount of force. It's especially in the car manufacturer companies, such as US Car, for example. They are using different type of simulation. Santos is one of the famous digital human models, and if you work in the companies that they use these modeling systems, so you need to learn and practice using this software. For all the ergonomic redesign, usually 3 categories are important. One is design of workstations, the other one is the design of tools, and the last one is design of the work method. I believe we practice and we discussed about the different methods that we can use to, for example, minimize the awkward postures or minimize the excessive force or the frequency of the work. We can use how we can teach the workers to, for example, lift a load, or how we can design the workstations, how we can give them enough breaks or rest time. So these are the things that you should consider when you are redesigning a workplace or workspace. When you have more responsibility in the field of ergonomics, occupational ergonomics, you may use different models. For example, this model is a model for a healthcare system, and you can see that in this model we have a work system, the process, and outcomes. I go a little bit through different part of this model. This model is called System Engineering Initiative for Patient Safety, or SIPS, and it's very common in many healthcare or hospitals, workplaces. In work system, 5 components will be taken into consideration. One is person, looking at the individual differences in respect to the education, skills, knowledge, motivation, physical characteristics, psychological characteristics. Then our organizations, the type of organization, how the teamwork is going there, how the management system is, the supervision system, how it works, the social relationship, the work schedule, and these things, anything that is related to that organization. Then we have environmental factor, factors such as the noise, lighting, the temperature, the workstation design for the nurses, for example, or for the different healthcare providers. The fourth component in the work system is the technology and tools. For example, the IT system, the recordings of the medical files, the medical devices that the people should use, the human characteristics in interaction with the technology. These are related to the technology and tools. And then we have the tasks. Evaluation of the variety of the tasks, how much autonomy the people have during doing these tasks, how much cognitive load is applied to people during these tasks, or how much attention they may need to have to doing the job or the task properly. Then in the second part, you have the process. After we evaluate the 5 components in a work system, we need also to check the processes. The processes can be related to the care, the caring of the patients, as well as the exchange of information, providing or preparing the materials that are needed in the system, cleaning, especially in healthcare system. It's very important about the how they remove the biohazards and the things like that. So the important thing is that whether these processes are going smoothly or not, and if there is a gap, if there is a problem, if there is a stop in this process, it means that something is wrong. All these things are for the sake of the outcomes, and the outcomes is not just related to the healthcare. Of course, the healthcare and the patient's outcomes is very important in respect of the quality of care and the patient's safety, but also the outcomes of the system that is designed can be related to the job satisfaction, where the people who are working in this healthcare system are satisfied with their jobs, whether they are under stress or burnout, or whether they are under any kind of risk for their health and safety. It was just an example of an ergonomic model, and you can see that how different components can interact with each other. For example, here when you see that the process, if you have the feedback and you see that you have some gap in your processes, you will be back to the work system to see what is wrong there that caused this gap in the process. Or when you see that the outcomes for your patient or your employee is not, or your organization is not as desirable as expected, then you again look at the work system and you see that what the problems may be and how we can modify those problems. As I told you before, and I showed you this slide, ergonomics is a multidisciplinary field. So for a model like this, for example, the healthcare model that I showed you, you need a team to work together. The team members should work together, that we can provide that safe and efficient place for both the stakeholders and also the workers. So you should notice that all the changes that we talked about, or the redesigning or economic interventions, are good, but they are costly. It's very important that ergonomics, the ergonomic system and the business system, they have the same language. I mean, we should translate this ergonomic information and science to business language in order to be able to provide a change. Because what is important for business is that whether this intervention can somehow save money for the system or reduce the expenses for the system, this is the main question. And many of ergonomic studies at the moment are trying to provide more evidence to answer this question. I believe I showed you this slide before. So even the rough numbers are meaningful. So you can see that how much money has been spent in for different preventable type of problem and disorders in workplaces in US. And sometimes you think that whether this cost is acceptable. I'm telling you this because if you want to have an effective economic intervention, you need to have a team working, and you need to convince the business and the managers for the work that you want to do. So you need to have this model to somehow contrast the risk versus the cost, and to identify the problems, have a plan to the problems, and show that how much can be saved, and in respect of reducing the number of severe injuries, or the severity of the injuries, or the time of return to work, and show by figures, by numbers, that how this can affect the system. I would like to introduce you some organizations in Canada that are very helpful in the field of ergonomics. You can find the rules, the regulations, and also you can find many information, many scientific information, epidemiological information in their website. So let me go through some of. For example, WSIB, or Work Safety and Insurance Board, provides the insurance and compensation for the workers, and so you can look at their website. You can find many information related to the type of injuries, the most common injuries that they the WSIB has paid for those injuries based on different years, based on the different type of work, and they will give you very good information about the income, the amount or the cost of injuries in different workplaces at different times. So you have Ministry of Labor. Ministry of Labor, again, I put the website for you. If you want to look at their website, you can find the information that may be interesting for you. But the Ministry of Labor is in charge to set the safety legislation, acts and regulations for different workplaces that can be followed in all workplaces in Canada. So it's important that you understand the differences between Act, rules and regulations. Act is a law that should be passed by the House of Assembly, and when the Act is passed, the government will develop some specific rules, and based on these specific rules or regulations, different organizations they prepare the guidelines, which is based on those regulations, and these guidelines should be met by different workplaces, organizations that are active based on the country's regulation. They should follow those guidelines and regulations. For example, one of the famous laws in occupational ergonomics is the Occupational Health and Safety Act, which is passed by the House of Assembly. And the focus of this act is to maintain a safe and healthy workplaces, to set minimum standard for this safety, to regulate this health and safety issues, and identify the rights, the duties of workplaces parties. If you want to know more about this act, you can look at the website that I provided for you in this slide. We have also health and safety associations. There are different associations based on the type of work that they are involved with. For example, IHSA are mainly related to construction, or PSHSA is related to healthcare, or WSN is related to the mining. So these associations provide resources for training and based on in different provinces, and the sectors, the training that are related to the sectors that they are their main interest. There are also different research centers that they specialize and work specifically in the field of occupational health and safety. For example, IWH, or Institute for Work and Health, or CREMSD at the University of Waterloo, that they work on mainly on musculoskeletal disorders, or OCRC, or Occupational Cancer Research Center, that they mostly work on work-related cancers, and also CREOD, that involves with the non-malignant or non-oncologic occupational diseases. These centers may provide different type of grants. For example, I know in CREMSD we have a seed grant, almost $10,000 for a study, for any study, any proposal that is related to musculoskeletal disorders. You can find other grants in the other organizations. You need to check the websites, and if you are interested to do research in the field of occupational ergonomics, I suggest you to look at their websites and check the criteria. We have also occupational health clinics for Ontario workers, OHCOW, which provides comprehensive occupational health services, and I believe it's free of charge. So if you need more information, you can go through their website, and you can see which kind of facilities they can provide for the workplaces. In respect to education, we have Workers' Health and Safety Center, WHSC. This center provides training for workers, for the representatives, for the employers, especially in the field of health and safety. So you can also look at their websites if you need more information. I believe you have enough information now and enough resources that to use if you want to work in a specific sector, so you know how to find the information, how to organize the information. And I hope this course and the materials that I provided for you during this course can help you to be a better ergonomist and to be a person who can do very positive changes in any workplaces that you may work in the future. Thank you very much for your attention. It was a great honor and pleasure to be in contact with you and to have this course with you, and I wish you all the best in any path that you may take in the future. Thank you so much.